So I'd like to welcome everybody to our webinar this afternoon. I'm Dr. Joanna Wozniak-Brown. I am the Assistant Director of Resilience Planning at the Connecticut Institute for Resilience and Climate Adaptation. I'm pleased to welcome you to the third in a series of webinars about climate change and public health. Today's presentation is on equity and climate change and public health. Equity is a critical piece to planning a truly resilient community. Today, our presenter is Dr. Mark Mitchell, an Associate Professor of Climate Change, Energy, and Environmental Health Equity at George Mason University's Center for Climate Change Communications. Dr. Mitchell earned his medical degree from the University of Missouri, Kansas City, and his Master's of Public Health from the Johns Hopkins University. If you have any questions throughout the webinar, please post them in the chat box and we'll answer them at the end. As a reminder, the presentation is being recorded, and you'll be able to view this webinar and all of CIRCA's webinars on our YouTube page following the event. I'll now turn the presentation over to Dr. Mitchell.
Great. Yeah. Let's see. I can share my.
All right, I'm just going to stop sharing.
Yes, please.
And switch it over to you. There we are, sir. Should be switching momentarily.
Yes, got it. So I certainly want to thank you, Joanna, and the Center for sponsoring this event. So I will be talking about equity in climate change and public health. So I will start with defining terms of systemic racism, environmental justice, climate justice, and then talk about health disparities related to the environment, and then I'll talk more about climate and health, and I plan on winding up with some recommendations. So we have a lot to cover. What is systemic racism? First of all, people think that systemic racism is an insult, but it's not. It's really a description. And what it is a description of policies that involve multiple institutional disciplines that have a disproportionate racial effect, which is sometimes what we call health disparities. Examples of the policies that have differential racial effects, also known as systemic racism, are the policing policies, which we've seen with George Floyd's death and the stop and frisk policies, as well as policies in the justice system, such as the disproportionate incarceration rates of African Americans and Latinos and people of color, which of course affects their prospects for being able to get a job afterwards, etc. Then we have health system disparities, the higher uninsured rates, the lack of access to health care. There are housing policies that affect, have disparate impacts, such as access to home ownership, which is, of course, the largest source of access to wealth in the United States. And so when the federal policies denied, when they redlined districts and didn't allow African Americans primarily to move out of those districts, they prevented African Americans from acquiring wealth. And that is in addition to that, there are the financial policies such as higher interest rates or no mortgages available for African Americans. But I've experienced, the same thing. I've been had higher interest rates when I tried to buy a home. And then there are economic policies such as lack of access to wages and jobs, and so accessing lower income jobs. Educational policies, there are, the education system is based on where you live, based on your tax structure. Most people try to move to the community with the best. Most people with children try to move to the community with the best education that they can afford to live in. And there are also, lower graduation rates and test scores among people of color. And then there are transportation policies, access, whether you have transportation, do you need a car? Do you have access to public transportation? Access to jobs, most of the entry-level jobs are created in the suburbs. Do people in urban areas have access to transportation to those entry-level jobs? All of these policies also affect health. They are known as the social determinants of health. And all of these policies and more work together to disadvantage people of color of all income levels. Middle income African Americans make less than white high school graduates. I'm sorry, college educated African Americans make less white high school graduates, et cetera. And so it's because of all of these policies that work together to disadvantage people of color of all income levels. So then I'll talk about environmental racism. What is environmental racism? Environmental racism is systemic racism. It's the greatest in Connecticut, in the United States, and globally. The greatest predictor of where environmental hazards are located is the percentage of people of color in the community, not the income of the community. So again, middle income African American communities will contain more environmental hazards than middle income white communities, and upper income African American communities also contain more environmental hazards. And this greater exposure to environmental hazards leads to poorer health outcomes. I call racism a toxicant enhancer. If you're exposed to a certain level of toxics and you suffer from the health effects of racism, as well as the health effects of income, it will make that exposure more toxic. You'll have more health effects from that exposure. Let's see. Okay, so what is environmental justice? Environmental justice is about stopping environmental racism. It's changing environmental policies to reduce the disproportionate health effects that we talked about. The U.S. Environmental Protection Agency defines environmental justice as the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development of policies that affect them directly. So what do they mean by fair treatment? Fair treatment means that no group of people, including racial, ethnic, or socioeconomic group, should bear a disproportionate share of the negative environmental consequences of environmental exposures. Then what is meaningful involvement? Environmental justice requires meaningful involvement. That is that the involvement of those who are most impacted in the decision-making processes, that they can be involved in a way that can change the outcome of that process. Environmental justice is all about health. That is the main concern with environmental justice. So what is climate justice? Climate justice is simply environmental justice applied to climate change policies. Environmental justice organizations are community-based organizations led by people of color, low-income people, or those otherwise most impacted by environmental injustice. Environmental justice organizations often see their mission as being very broad. It's not just the environment. It is, as I said before, very much affected by health, but they also see climate as part of environmental justice, see economics as part of environmental justice, see racism, fighting racism as part of environmental justice, changing policies as part of environmental justice. I'll now switch to talking a little bit more about asthma as an example of one health condition where there is disparities in the environment and it's linked to climate change. We did a study, I live in Hartford, Connecticut, and we did a study on asthma in Hartford. We found that the group with the lowest asthma rates were West Indians, people, Afro-Caribbean immigrants, and those rates were lower than those of whites or Asians in Hartford. Then the group with the highest asthma rates in Hartford were not African American, but Latinos. It turns out that Puerto Ricans have much higher asthma rates than any other Latino group, and Hartford has a high percentage of Puerto Ricans. And in fact, if you look at studies, national studies, they show that West Indians and Afro-Caribbean immigrants are in better health than African Americans for one generation. Then their health drops down to that of African Americans. In Hartford, we are 80% Black and Latinx. The last study that I showed, that I know of asthma in Hartford showed a 20% asthma rate, more than double the national average. Hartford has the trash incinerator with the fifth largest capacity of any trash incinerator in the United States. Bridgeport is number 11, number 10 or number 11 in the country. Also, urban areas are more likely to have large power plants and the pollution that comes from those power plants. I do consulting, I have done consulting for environmental justice groups around the country, and I find in each of those communities that the people in those communities are suffering health effects disproportionately from the effects that you would expect from exposure to the air pollutants, the air toxics from the industries that are surrounding them. So if they're producing a lot of dioxins, we see health effects of dioxins, the endometriosis, the cancers rates. If we have trash incinerators, we see asthma. So asthma is 50% higher in urban school districts in Connecticut when compared to rural school districts. The asthma death rates are 6 times higher in Black teenagers and young adults when compared to white males with that same age group. And in Connecticut, more than half of all lead-poisoned children are Black or Latino, even though the Black and Latino population is little more than 25%. But asthma is not the only disease where we see health disparities. We see increased death rates due to cardiovascular disease, cancer, diabetes, lupus, even mental health issues such as depression, learning disabilities, ADHD, low birth weight, sudden infant death, and also sudden death of athletes, which we now know is related to particulate air pollution. And people of color are more likely to be exposed to more than one of these things at the same time. more at risk of cumulative exposure to a number of different types of environmental toxicants. And the environmental siting policies, where new environmentally hazardous facilities are cited, those policies and the political power often lead to environmentally hazardous facilities being located in communities of color. As you probably know, zip codes are very good predictors of life expectancy because of these exposures. So some common environmental justice exposures are landfills and dumps, waste transfer stations, contaminated former industrial sites known as brownfields, hazardous waste sites, more likely to have PCBs in soil, more likely to be exposed to a lot of air toxics such as the trash and sewage sludge incinerators. Again, Connecticut burns more of its trash as a percentage than any other state in the country. Power plants, oftentimes even the natural gas power plants have ammonia gas. There's contamination of water from chemical and pharmaceutical sewage contamination, mercury and PCBs and fish, and so on. There are many there are local businesses such as dry cleaners, auto body shops, nail salons. About 10% of nail salon workers have to quit because they become allergic to the chemicals that they're working with. And these facilities are often Southeast Asians, oftentimes work in these nail salons. Cement kilns, refinery, chemical plants, and so on. So again, these facilities are more likely to be located in communities of color or across the street from communities of color. So if we look at air pollution in Connecticut, air pollution not only contributes to the increased rates of COVID among African Americans and Latinos and indigenous peoples, but also contribute to asthma, other respiratory conditions, heart disease, cancers, learning disabilities, particularly air pollution associated with transportation. So these air pollution sources are more often located in communities of color. I live in the center part of Hartford, and my neighborhood is a very low-income neighborhood. 2/3 of the people in my neighborhood do not have, two-thirds of the households don't have cars. Yet we have some of the highest traffic pollution in the state. Because of other people driving through our neighborhoods or going to businesses or so on like that. So the people who contribute least, this is an example of how the people who contribute least to climate change oftentimes suffer the most from climate change. This traffic air pollution contributes to greenhouse gases also. As well as direct air pollution effects. And so we know that global warming exacerbates the air pollution. The ozone heat increases the amount of ozone. If you look at a map of Connecticut, and you'll see here that in the blue shading is the percentage of people of color by census block group. The yellow dots are the air pollution sources that are reported to the EPA, and you see that there's a direct correlation between the yellow dots, the air pollution sources, and the people of color. And as you know, Connecticut is the second most densely populated state. So there's a lot of people living in this area, a a lot of wealthy people living in this area, but there are very few air pollution sources outside of the communities of color here. So we'll talk a little bit about climate and health. Just like everybody's affected by COVID-19, all people are affected by climate change, but some are more affected than others. Those people who are most impacted by climate change, like I said before, have contributed to it the least. They are lower income, tend to be lower income, have smaller residences, use less electricity, and then therefore produce less greenhouse gases. Many people see climate change as existential threats. Environmental justice communities see it as another existential threat, in addition to the asthma from the air pollution, in addition to the exposure from contaminated water. Virtually all studies show that African Americans and Latinos are more concerned about air pollution and water pollution, but not as involved. So we'll switch to talk a little bit more about climate change. The last 5 years have been the hottest 5 years on record in over 100 years. The last 5 years are the hottest on record. In 2019, particularly in the Southeast, it was much warmer or record warmth in several states. But there was a polar vortex in the middle of the country because of the instability of the polar caps where the cold air used to be, but you'll see that Alaska also had their record warmth last year. So as we see rising temperatures, we get more extreme weather. This leads to air pollution, changes in vector ecology, increasing allergies, extreme heat, extreme weather, and these lead to injuries and fatalities, asthma, cardiovascular disease, respiratory asthma, as we talked about, but also diseases such as West Nile virus, Lyme disease, Zika, moving to different locations. And around the world, we see more forced migration, civil conflict, mental health impacts, particularly among countries, lower income countries, lower wealth countries. So in medicine, we oftentimes use mnemonics to remember different things. And so I created a mnemonic to remember the health effects of climate change. And the mnemonic is heat wave. And the H for heat wave is for heat exhaustion and heat stroke and other direct heat effects, which is the most common weather-related death in the United States. The E is for exacerbation of pre-existing cardiac and respiratory disease, A for asthma, T for traumatic injury, W for water and foodborne illnesses, A for allergies, V for vector-borne diseases such as West Nile and Zika, and E for emotional and mental health conditions such as post-traumatic stress disorder. And if you look at the disparities, the health disparities of climate, we see that heat common and heat stroke are more common in people of color and low-income people because of lack of air conditioning, and they're more likely to be outdoor workers, including farm workers or other outdoor workers. They are more they're more likely to suffer from exacerbation of pre-existing cardiac and respiratory disease because of the increased rates of those conditions, as well as the increased rates of asthma. We see more traumatic injury because of less ability to flee if there's a hurricane or something coming, or households that are less able to withstand severe weather or recover from extreme weather. If you don't have insurance or money to rebuild or repair your home, you are not going to be able to recover from severe weather. In water and foodborne illness, we have less access to clean water, particularly on tribal lands. In many tribes, a third of the people don't have access to running water. And there's the inability to afford healthy food, particularly if you live in a food desert. There's more subsistence fishing. I talked to a fisherman a few years back fishing here on the Connecticut River in Hartford, and asked him what he did with his fish. He says that he takes them from housing project to housing project to sell them. And I knew that they were contaminated with mercury, but you know what? But that's what happens. With allergies, again, if people have air conditioning, they can reduce their allergies, indoor allergies. But if you don't have air conditioning, or if you're an outdoor worker, you are going to be exposed more often to pollen and have your allergic reactions. Vector-borne diseases such as fever, so things that are spread by ticks and mosquitoes. And if you have no or inadequate screens, you're going to have more mosquitoes in your place. We also know that mosquitoes that spread disease, that the tiger mosquito is more likely to live in tires, that and if there's water that's standing water in tires, then tiger mosquitoes are more likely to go there. So where do we have standing water in tires? More likely in low-income communities. And then we talk about the E, emotional and mental health, such as PTSD. And if you are less likely to be able to flee from severe weather, you're more likely to have the PTSD. So I want to end up with the recommendations. The first one is that, as we said before, people of color are more likely to be exposed to air pollution and likely to live near coal-fired electric power generating facilities and also natural gas facilities. There are a couple of reports that have come out about that and about the increase in asthma that's associated with living near these facilities. And so activities that reduce greenhouse gases in the long term oftentimes reduce air pollution and water pollution in the short term. And so therefore, climate solutions, if designed to do so, can have a beneficial effect on people of color disproportionately. And I argue that we should be making sure that the policies that we enact to address climate change also address inequities and lead to more equitable policies. So planning for the most vulnerable will reduce suffering and save the most lives. And which populations are vulnerable vary by the threat and the geographic location. These populations have the experience and expertise and information needed if you're planning for resilience, trying to climate resilience and climate adaptation. You should involve those who are most affected because they can provide you with the best information and the most effective plans, and help you to improve your plans. So that's why I argue for hyper local adaptation planning, because the threats and the responses to the threats vary widely across the state. For example, there are areas where there's only one way in and one way out. And you may look at a map. I had this experience in Louisville, Kentucky. On the map, there was a neighborhood, and the map showed that there were two roads going in and out of that neighborhood. What the map didn't show was that one of those roads was blocked off and overgrown, and that the other road was there was a railroad track crossing the other roads. And the residents told me that oftentimes there will be trains stopped on that railroad track, or periodically there will be trains stopped on that railroad track where the people could not leave or enter that neighborhood. What's more, I found out that the neighborhood was on the other side of the dike, was on the river side of the dike. And so if the river flooded, then that neighborhood would be gone. And people could very well be trapped in that neighborhood, even if the city was saved by the dike. So you need to plan hyperlocally. You need to look at specific conditions in each neighborhood and which populations are vulnerable in each neighborhood. And those people should be part of the planning and should be part of knowing what the climate threats are. There should be state funding to pay for planning for each town and for including the people most affected in the planning process. The GC3, the Governor's Council on Climate Change, and state agencies can provide the information, tools, and guidance for communities and towns to develop their own local adaptation plans. Let me, in the interest of time, I'll go ahead and skip this slide. But there needs to be funding for environmental justice. Environmental justice organizations in Connecticut have been severely hampered by a lack of funding, and they need both state and private funding. It's critical to get state funding to educate and engage those most impacted in the Governor's Council on Climate Change, GC3 planning process, especially on the local level. There are very few foundations that fund environmental justice in Connecticut, and we believe that government can and should fund environmental justice in local communities to be engaged in the GC3 process, and they should help to encourage the development of private funding. And there are a number of ways that environmental justice organizations have been funded in other states. So I want to leave you with the last thought that as we try to address COVID-19, as we try to address climate, we know that with both of these, that the world will never be as it was before our current crises. If we're deliberate about our efforts, we can make things better and be more prepared to address our climate crisis and systemic racism. We're not interested in equality. We're interested in equity. The people who have the most need should be getting the most support. So let's plan to come out of the coronavirus pandemic to a more prepared, just, and equitable world. Thank you for your attention.
Thank you, Dr. Mitchell, for, I know there are many webinars, but you did a fantastic job covering a wide range of important information. So I really appreciate that. We got a comment already, somebody saying, well done. So it's not an easy task for sure. So now I'm going to be opening it up to some more questions. But one of the things that I wanted to start with was if their municipalities or councils of government are looking for some more information about ways they can incorporate equity into their planning, what are some good resources that you've seen?
Right. As you know, Joanna, we are putting together a series of webinars, the Equity and Environmental Justice work group of the Governor's Governor's Council on Climate Change is putting together a series of environmental justice webinars every Thursday from 12 to 1 o'clock. And so I would encourage people to attend those webinars. And I think that there are a number of other resources that people can use in planning, but the best is to, like I said, to engage people in your town who are more vulnerable. The Equity and Environmental Justice Working Group is coming up with other resources in addition to the webinar, such as how to engage disabled people, how to find advocates in your area. But unfortunately, because of lack of funding, it is very difficult right now to engage environmental justice organizations. But like I said, those webinars are tools that we want you to take advantage of to think about how to incorporate equity into your planning.
I just put the link in the chat box for that, the link to the upcoming Equity and Environmental Justice webinar series. It's a fantastic suite of topics, so I encourage everybody to check those out. Oh, we have another question that says, with basically power provided by semi-monopolies, would you consider charging for electricity by air quality or income at the power use address?
Yeah, so energy policy is another area that is sorely in need of advice from environmental justice experts. As you know, as you may or may not know, Connecticut has one of the highest base rates charges for electricity. It's the highest in New England. And therefore, low-income people will pay a higher percentage of their income on energy. In addition to that, our next webinar on Thursday will talk about energy poverty, where people can spend inordinate amount, 10%, 20%, even 30% of their income on heat, trying to heat their homes in the wintertime. And of course many people can't afford air conditioning. So there need to be ways of changing the policies so that the people who can afford it most will pay proportionately, close to proportionately. So one of the things that I advocate is that there be a charge based on the amperage of potential of your home or building. So if you have 50 amp service, then you will pay a lot less than 100 or 120 or 200 amp service. But these are things that really need to be looked at, and I think that we need we need to hear from those who are working with low-income communities on how to make our system fairer. Right now, as I said before, power plants are more likely to be located in urban areas in Connecticut or in environmental justice neighborhoods in places like Stamford. So again, those facilities, as we switch to clean energy, we need to make sure that the clean energy jobs are in urban areas where they're needed the most. The solar, installation, those are good jobs. They're good paying jobs. And we need to make sure that we're closing the natural gas and oil and power plants that are located in environmental justice communities.
So we have another question. It says, according to your reading, it seems that only top-down initiatives, such as government legislation, could create impact-changing policies. However, most of the time it lacks sensitivity to existing local conditions. Middle-up initiatives, such as nonprofits lobbying, require long-term investments. Is the middle-down community activism enough to produce impact?
Yes, it's absolutely enough to produce impact. The grassroots, particularly, but also grass tops, is, I used to be the director of the health department here in Hartford. And what I found is that there were a lot of interest groups that would come to me, corporate interest, the political interest, the small business interest, and the community. But what I found was that those that are most impactful were grassroots, organized grassroots groups, as well as the corporate interest, were the two groups that I found were the most impactful in changing policy. As a government employee, it was, anything that I did, I would get a reaction from one interest group or another. So unless there was an interest group that was strongly supporting the things that I thought that I knew were best for health, I couldn't stand out. I couldn't step out and push for policies that I thought were best for health unless I had the cover of grassroots organizations, or at least some other interest group. And I knew that as a government employee, I couldn't ask for more funding for my organization, but others could. And they could say, we need funding to address this aspect of climate change, this aspect of equity, and that we need to hire somebody to address asthma in the health department. I couldn't do that, or if I tried, I wouldn't be effective because it had to go through the chain of command. But outside groups could do that. It was very beneficial when they did.
I think that points to the, as you had mentioned earlier, the critical importance of engaging the local groups early in the planning process to build those relationships. So you not only have the local knowledge, but you are sharing information back and forth, so it's prepared to make those planning decisions more effectively.
And they, the local groups can prioritize which of the which of the options are more important and can have the most impact for them, and they can advocate to get these things done. Previously, there have been several plans on climate change adaptation and mitigation. And many of them haven't gone very far because they didn't have the support of the community and the advocacy community. And so I think that engaging the community not only makes better plans, but it makes it more likely that those plans will be implemented, and that they'll be implemented in a way that they'll be able to get the resources or advocate for the resources needed to implement them, and that they'll be implemented in a way that will provide the longest term benefit to the community.
I'm really sorry that we have to end it there. We're trying to do some time integrity with our mini webinar series. So I'm very appreciative to you, Dr. Mitchell, for your presentation today. We hope that everybody will enjoy the rest of the webinar events in our series. We have vector-borne disease, recreational water, and emergency preparedness coming up. So on our screen, you'll have in the upper right-hand corner is a short link for you to join the rest of the series. And thank you very much, Dr. Mitchell. And we look forward to also enjoying your webinar series and the Equity Environmental Justice series coming up.
Well, thank you, Joanna. I appreciate it.
Have a great day.
Mm-hmm. Bye.